All right, so let's get started. Hi, everyone. Welcome to today's webinar. My name is Naveen Saleh. I'm the Communications Manager at the Canadian Observatory for Homelessness. I'll be your contact throughout the webinar on all tech matters. So if you have any issues, please send me a message through the questions box. Some housekeeping things. You can listen to the webinar using your computer speakers or using a headset. If you have any questions for the presenters, you can use the question box to post them. We will be monitoring it and responding to the questions at the end of the presentation. We will also be sending the attendees a link to the webinar recording and any other general links, and it will be posted on the Away Home website as well. So if you haven't already, please take a second, say hello in the question box and tell us which region you're from. And now I'll pass it along to the brains behind these webinars, Mary Jane McKittrick.
Thanks, Naveen. So welcome, everyone. My name is Mary Jane McKittrick, and I'm the Community Planning Manager with a series of webinars from Away Home designed to increase knowledge and capacity on youth homelessness community planning. Today, I'm very pleased to feature a community that has been pioneering this work of preventing and ending youth homelessness for 5 years now, and that's Kingston, Ontario. I would also like to thank the Government of Ontario for their generous support of this webinar series and their commitment to increasing the capacity of communities to prevent and end youth homelessness. Oh, I can't change the slides. Oh, there we are. Okay. I would also like to acknowledge that this series is in partnership with the OMSA, the Ontario Municipal Social Services Association, and the Canadian Observatory on Homelessness. And a special thank you back to Naveen from the AWH today for all her support in setting up and running of these webinars. So Away Home Canada, as many of you may know by now, is a national coalition of partners that are dedicated to preventing and ending youth homelessness in Canada. We use a collective impact approach or framework to organize. We bring together key players that touch on youth homelessness from across and within the nonprofit, private, and public sectors to align our resources and efforts around youth homelessness. You may recognize some or all of the names of some of our partner organizations. You can also find more information about our coalition partners and the recordings of these webinars at awayhome.ca. So I'd like to welcome our presenters today and introduce them. First, Pavna Varma is the President and CEO of the United Way of Kingston, Frontenac, Lennox, and Addington, a role she has held for the past 18 years. Pavna works closely with agencies, community partners, government, private sector, and people with lived experience on addressing youth root causes of social issues through collective impact. She leads the Youth Homelessness Initiatives, co-chairs the local youth employment strategy, and food access initiatives. Kim Hockey has been with the United Way since 1995, and as Director of Community Initiatives, her current role includes work in the areas of homelessness, youth employment, poverty reduction, and early years. She provides backbone support to United Way's collective impact initiatives and the collaborative work that the United Way does with its partners across the community. Tara Everett is the Program Manager for Kingston Youth Services at Home Base Housing. Tara has 22 years experience in youth work, including a youth justice and supportive housing, housing first, and prevention programs for homeless youth. Most recently, she's the leader in collaborating with 20 social service organizations in establishing the new One Roof Youth Services Hub in Kingston. In her role at Home Base Housing, Tara is responsible for overseeing a Housing First program, prevention and diversion programs for youth, and coordinating the youth homelessness system with the Kingston Youth Shelter as part of Kingston's 10-year housing and homelessness plan. In addition, she manages 29 units of supported and transitional housing programs for youth. And part of her work includes sitting on the United Way Youth Homelessness Steering Committee and the National Learning Community to End Youth Homelessness. So just go over the agenda a little bit. It's pretty simple. I'll just do a quick introduction on the webinar series and our resources and give you some, that is. And then Pavna and Kim, will discuss ending youth homelessness in the Kingston area and their work. And Tara will really focus in on the One Roof, Kingston's Youth Homelessness Service Hub. And then finally, after that, we will have some questions. So please, as Naveen has mentioned, please put your questions in the question box as we move through the presentations and as you think of them, but we will be responding at the end. So I'm just going to do a quick overview of some of the resources that we have at Away Home Canada to support community planning. We've been doing this work since 2013. In fact, we began with Pavna and Kim and the Kingston youth plan at that time. So as a result, we have and continue to develop resources and supports that impact the broadest number of communities possible. Some of the following links here or points describe some of the supports we provide. So first of all, our community planning toolkit. If you've not had a chance to read our Youth Homelessness community planning toolkit, it is highly accessible online or in PDF and is based on the learnings from communities across Canada. If you have any questions or need support with this resource, it's quite robust, please contact me. Or even if you're just considering engaging in a youth homelessness strategy, please feel free to give us a call and we'll walk you through the first steps. The webinar series, of course, is a key element to increasing capacity for communities to do this work. It gives communities access to content experts, deeper dives on topics covered in the toolkit, but as well as the emerging trends and issues in planning. We also have an online community of practice, our workspace, and there's the link there. It's hosted by the Homeless Hub. The workspace provides a forum to post issues, ask questions, and create the discussion about youth homelessness community planning. And then we also have a newsletter and mailing list, and that's also found on our website. Just a little bit more detail about the community planning webinar series. Our past webinars, our past webinars include the Community Planning 101, Collective Impact and Roles for Local Government, as well as a series on research and data management. There's 3 on those, and assessment tools. So those are all available on our website. You can go back and review those at any point. But the future webinars we're planning for 2018 include as follows. Some more featured communities, such as Kingston in action. We really are doing a lot more work in terms of policy, provincial alignment, and systems planning at Away Home. So we'll have some more goodies for that, as well as the youth homelessness prevention. So that'll include models and the change management that's required for communities to support this shift and how we work differently together. So here's a sample of some key youth homelessness resources that we have. They include toolkits, guides, research, policy briefs, and program models. And I'll just point out a couple today, the most recent ones added. The red report at the bottom, What Would It Take? Youth Across Canada Speak Out on Youth Homelessness Prevention. That one's a key tool to support the development of prevention strategies in your community plans. It can also provide context and framing as you conduct your enumeration. I'd also like to point out at the top right, the second from the right, this is Housing First, the program model guide. This resource builds on our Housing First for Youth framework and supports the implementation of a Housing First that is targeted to support youth, rather than just trying to stretch the adult model to accommodate the needs of youth. So I think this will be very beneficial as you develop your Housing First for Youth strategies as well. So they can all be found in the resource section of our website. If you're engaged in community planning or thinking about it, please give us a shout. But now it is my pleasure to hand this presentation over to Pavna Varma and Kim Hockey, who will begin the content portion. Thank you. Take it away.
Thank you. Thanks, Mary Jane. We're here together, Tara, Kim, and I, and we'll start the presentation, and hopefully it works for everyone. Thank you, Naveen, for the technology support. And I see I now can move this. I can't move it. Okay, there it is. So we'll talk a little about the work that's happened in Kingston over the last, I would say, 4.5 years. Some of you, this might be repetitive. It might be something you've already done, so bear with us because we recognize that many of you are coming from this at different levels of your progress, but happy to answer questions at the end. So one of the first things we did, obviously, as most of you are probably doing, is collecting data. And we started off with our just trying to get a sense of what the issue was like in Kingston and area. What we found was probably no surprise to anyone that we had a high rate of youth who were in shelters and an even larger population of youth who were actually couch surfing or in precariously housed situations. It's hard to collect the information on the precariously housed, but I'll talk a little bit about how we tried to gather some trends through a process we developed. One of the alarming pieces that we found was what a large population of female homelessness we had. And this is not just with youth, it's across every age group in Kingston. So we know it's something we need to pay a little more attention to. And that's something that we're working as a community separately on, trying to identify the causes, what we can do about it. So to start off, one of the things, and again, many of you are familiar with this, but what we decided to go with the community impact model, the collective impact model, because we know many of you collaborate, many of us collaborate on different things. So for example, Tara will tell you about an amazing collaborative that has developed in Kingston with many partners working together, but they already knew what they wanted. They knew what was needed. They came together, they had formal, informal agreements, and it's really working well together, and she'll tell you more about that. But for the whole issue of youth homelessness, we realized it was not an issue that any one community any one organization could do by themselves. It had to be a collective approach. There was no apparent solution. We just knew that we had an issue that we needed to deal with. So we decided to go with collective impact. Again, we were very fortunate that we're a medium-sized community. It works really well. We all know each other. We're getting to know each other even more as we work together. But we had a common mission, vision, guiding principles. So initially, we spent a little time on that just to make sure we were all on the same page. And then we started to really roll up our sleeves and get to work. So first of all, as I said, we collected quantitative data, things like what age range do you start with? And there's so many different schools of thought. We went with the simplest solution, which was to go with 16 to 24. Because quite frankly, StatScan can really help you with a lot of basic data in those age ranges. And we didn't want to go under 16, though of course some of the youth some of our programs are targeting younger people. But we also decided to go up to 24 because we know many of our youth who are vulnerable need help at least till the age of 24, if not beyond. But the biggest piece for us was really listening to youth, because that was where we got the best data. That's where we got a lot of the information that's actually formed the framework and informed our strategy. So Kim, do you want to tell us a little bit about the point in time count?
Sure. So one of the things that we developed here locally was, rip off and duplicate of the national on the streets out communities point in time counts. But what we did was realizing that youth have trust in their teachers and ACWs in the schools, and recognizing that when things start to happen in a youth's life, typically they are still engaged in school. So we felt that if we could get to the schools and have them give us some insight, that would give us a better understanding of at least the youth who are still engaged in school, what their situations were. So we work with them annually to provide us data on what they know in terms of youth who are absolutely homeless, living in shelters, attending schools, living in transitional housing, but also those that are bouncing around from friends to family to relatives' couches. So that's been really robust information, and it's really given us a lot of insight, particularly for our rural communities.
So going back to Kim's point about we know where youth trust even our qualitative data, we actually accessed a lot of that data through our agencies. We had consistent questions, but then agencies like Tara's agency, Home Based Housing, and Youth Shelter, and all the agencies who were around the table, they actually spoke with youth. We provided the pizza, we provided the questions, and so we believe we got some really good information through this data collection process. What we have actually seen is we had 20 youth in 2014 when we first started doing this. We had 12 the last time that we did a point-in-time count, and we're doing another one in April, so it'll be interesting to compare numbers. We have increased transitional housing as a deliberate, intentional effort, and we have seen more youth. Our transitional housing units are all full. We have 23 and they're all full. And the process that Kim talked about, getting to know how many youth in schools were precariously housed, it's been pretty consistent. We had 111 in 2014, and we now have 108. So these are data points that we keep collecting. But what we're thrilled about is that we have actually seen the needle move through our collective efforts. We have fewer youth in shelters and more in programs who are housed, whether it's transitional or permanent housing. When we first started, we had 30% of people in shelters were youth. And now we've seen that drop down to 1 in 5. It's still a high number, but it's the average across the country. And we're hoping to drop that even more. But we did see a dramatic drop in the number of youth who were homeless in downtown Kingston from 50% in 2012. Last count, there were none. That doesn't mean there aren't any youth on the streets, but it certainly shows us the trend of youth who are homeless downtown Kingston. So again, the resources, Kim is the backbone coordinator. She pulls it together. And that was something we learned through our, we were fortunate to get an InnoWeave grant. And that was incredible because we all thought we all thought we were super people who could do this from the sides of our desks. But something as complex as this really does need a dedicated resource. And so having Kim full-time on this was really very, very helpful. We did get some funding to start with that, and then we started to work on who we wanted at the table. One of the cautions, and many of you may have experienced this, is when to bring in the private sector. Obviously, the inclination is to bring them in right away, but they're not always comfortable with the chaos and the gray area when we're exploring different solutions. So we found they kind of weren't interested in that piece, but once we had our strategies, they've come to us and they're really actively involved at this stage. So we have a really diverse group. We started with about 20 people. We have about 40 people who attend our monthly meetings every month. And it's a Friday afternoon. The room's usually packed. They're incredibly positive and very useful meetings. We started with our goal statement. We started off by being optimistic and thinking we just have fewer youth in shelters. But as we started progress through our theory of change, and again, Mary Jane and her organization and InnoWeave were really good at coaching us through our theory of change. And we actually found that we needed to change it because it wasn't that we wanted to see fewer youth. We actually wanted more youth to start accessing our programs, because as soon as they accessed our programs, they were embraced by this amazing collection of agencies who can then help them address their needs. So we actually changed our goal statement. We also did a lot of work on trying to evaluate, and we built this into the process. It's something that we can certainly talk to you. If anyone's interested, we can have an offline conversation about how we collected our data and how we work together as a community to document our successes and moving forward. So one of the things that I would recommend if anyone's going through this process is to diarize along the way, because what we found very useful was some of the side benefits, things that we hadn't anticipated, some of the positive connections, some of the positive points of progress that actually, if we hadn't, Kim documented it very carefully because we did give a monthly report to InnoWeave. And that really helped us report back to the committee, but also helped us identify some of the things that we were doing along the way that worked. So the top 3 reasons that youth told us they were homeless was family conflict, not a surprise, addictions and mental health, not just their own, but their families as well, or their caregivers. And the third was, of course, employment and education, not having enough money and not having the skills necessary to get the kinds of jobs that would keep them housed. So we've decided as a community to focus on prevention. The second piece was around an integrated system of care. Even though we're a mid-sized community, it was amazing how much adjustment we had to make to work together. And the third was around housing options for youth needs. We added the rural youth, and that's a piece that we're still working on. This is our goal statement. By 2020, 80% of the youth who enter the homeless system maintain their housing or are housed within 30 days. And we have a theory of change developed. It's on our website, and when we send you the links later, feel free to scroll down and you'll find it. Again, offline, we'd be happy to give you more information about how we got to this goal statement. A lot of coaching through InnoWeave. It was painful when we were doing it, but we're very happy with being pushed to rethink our goal. This is our theory around prevention. If you see the center green on the left side, it's a large amount of services and resources that are going into intervention. What the youth told us was that if we spent more time on raising awareness, we wouldn't need as much investment of time in intervention. So we really followed their advice very closely. And this is our diagrammatic representation of what we believe. So moving forward, one of the things that I would recommend anyone, it's so wonderful to spend time listening and analyzing, and at some point, it's really important for any collective impact, and I'm sure all of you have experience with this, on when to move forward, and it's not always the right time. There never is a right time, but sometimes you just have to move forward and allow yourself time to course correct. One of the things that I often say is that it always takes more time than you plan. When we first started this, we were given that advice, and so we thought, okay, instead of 6 months, it'll take us a year. It's taken us 4 years to get to this point. So whatever time you give yourself, multiply that by a few times and just allow yourself the luxury of moving forward, but then course correcting as and when you need to. So here are some of the new programs that we designed. We put a lot of thought into what we needed to do differently, and we invested in some programs that have really proven successful. So the family mediation worker was a quick response to what youth told us, which is family conflict was the #1 reason they were homeless. This program is delivered out of the youth shelter, and the worker is mobile, goes to wherever the family is. We've seen that from the 77 families that this person worked with, only 2 youth actually ended up in the shelter. They were able to mediate and either have the youth stay home or find a safe place for the youth within family to continue to stay housed. The second one, and Tara will probably speak a little bit more to this, is the mental health outreach worker. Again, a mobile worker, because we know the programs for youth need to be mobile and where they're at. Even in terms of timing, we need to be flexible because not all youth have their crises or their or seek help 9 to 5. So again, our programs are quite flexible. As all of us know, LGBTQ2S, many of our youth need some support there. So we actually have supported a peer group. There's a lot more work we can do in this area, and Tara will probably speak to some of the issues that she sees. The fourth program that we really went out on a limb was Intersections. So Intersections was a program that started in Champlain, and we brought it to Kingston. It's a worker who's available by referrals from police, either Kingston Police or OPP. And they go in when there are behavioral issues that are non-chargeable. The youngest, in the first 3 months, this person was referred to 50 different homes, and the youngest client is 6 years of age, but they are they're exhibiting behaviors that we know usually result in some crisis and homelessness down the road. So we're trying to get to them really early, but it covers the age range of 6 to 12 and beyond. We're still working on what we can do about youth with mild intellectual disabilities, because they fall between the cracks, especially if they haven't actually been diagnosed on the spectrum. So we're looking at how we can do better with these youth. We do have one program, but again, we're kind of course correcting on that one. So our education and awareness program was our primary. This is what the youth told us was what we needed to do right away. So we were fortunate in getting some resources to invest in a formal education and awareness strategy. It was directly aimed at interventions for youth at risk who are homeless, 16 to 24. The youth also told us we needed to get into schools and increase the awareness for youth in general, because they suggested that we should start with youth aged 12 to let them know what causes homelessness so we can avoid it in the future. And of course, the side piece was reducing stigma among the general public. So we did invest a lot of resources in this. One of the things we were also told was educators. School was a safe place, and they wanted us to be able to educate teachers and school employees, because they might go to one teacher or the janitor and talk to them, but people didn't know where to refer them. So we actually have a forum as per their advice, and we directly speak to school boards and unions and teachers to tell them where they can send youth who are in crisis or precariously housed. We also have an annual forum for youth themselves. Kim, do you want to talk about the forum?
Yeah, the Youth Summit is really a lot of fun and very engaging. Of course, it comes together around the issue of youth homelessness. We have a youth council and our youth with lived experience who talk about that. but they engage with about probably 100 kids from across our community. All the high schools are invited to send their youth, also our local youth programs. So we've got a mix of youth, and they come together and they spend the afternoon working on breakouts and workshops on topics that are of interest to them. So while we're helping to inform them and give them education around youth homelessness and even what that looks like, we're also providing them with fun, interactive ways to access information and some skills around things like employment, on drug use. One of the big issues in all of our communities, of course, right now is the opioid crisis and legalization of marijuana, financial literacy, and topics like that.
Yeah. These are some of our stories. These are all local stories. The youth allowed their faces to be characterized. We actually were willing to use stock photos, but the youth actually wanted their stories out there. They wanted people to know what had happened in their lives and how they had sought help. So we were also, part of the strategy was to use their stories, because most youth, as we know, don't always trust adults or institutions. So rather than us telling them as a community where to go, we actually had youth telling them their stories and how they got help. So we have buses. The youth again told us that they all travel by bus, because in Kingston, all youth, high school youth, get free transit. So we have their stories in all the buses. We really learned from youth what we needed to do, and they've just been amazing at helping us develop this campaign. We're in all the schools. We've got life-size cutouts, we've got life-size stickers that go into schools and different places, so everyone sees this message and the stories. One of the things we knew we needed to do was, youth told us that it was very confusing. They didn't know where to go, because if they were under 15, they needed to go somewhere. If they had mental health, they went somewhere else. So they suggested that we get our act together and have a couple of places. We picked 211 as one number to call if they don't know where to go. But Tara again leads the youth services, and between them and the youth shelter, they've coordinated intake. We've got a protocol built in on who needs to go where and how, but that's all behind the scenes. As far as youth are concerned, they can go wherever they are comfortable, and they'll have access to help. I'm going to leave the Youth Hub to Tara, who in a few minutes is going to tell you all about that amazing resource that we have in our community. But again, that's a really great example of an integrated system. One of the things we really believe in is transitional housing units, because as we know, most youth who are homeless need some time to heal and to get themselves ready for permanent housing. And so we intentionally increased the number of housing units from 13. We now have 23 to 24 units, depending on the size of the families in them. We expanded the role of the emergency shelter, because again, if a youth has taken the time to knock on the door, we believe they also need to have programs ready to go with the youth. And Tara has been instrumental in working with us and the city on how we can transform the system. We meet regularly to make sure we understand if there are bottlenecks, and where there are, we've been able to parachute some extra resources to help. Tara just tells us she's again under-resourced, so we're going to have to see what we do about that. We also looked at policy changes, and this is something we can spend all day. That in itself is a lot of work, but we were really grateful that we were able to make headway with our local municipalities on a number of different ways that help the youth in our community. And tomorrow we are actually working with our healthcare system on how we can deal with youth who are in crisis with mental health, because we know that's something all communities are facing. And we have an all-day planning session tomorrow with healthcare professionals, psychiatrists, psychologists, hospitals, emergency, our youth themselves, and our frontline workers. We also had looked at youth employment, and as a community, it's again on our website, you'll see the link. We have developed a youth employment strategy to help youth who are looking for employment, whether they are vulnerable, at-risk youth, or they are youth who are doing well and have graduated. Our next steps are understanding what we can do differently in rural areas. Indigenous youth, 10% of youth through our point-in-time count who were homeless identified as Indigenous. We have a long way to go with understanding the issue and how we can address it. But we are starting by meeting with the local elders and seeing where we go from there. We're also hoping for our youth, especially the more vulnerable youth, to develop some form of social enterprise to help them get back on their feet. The lessons we learned was listening. Resources are essential. We were really fortunate in being able to find the resources we needed, being flexible and allowing more time than anticipated, as I mentioned earlier. I'm going to hand it over to Tara now.
Okay, thank you, Pavna. So before I get started to talk more about this integrated youth services hub that we have been launching in Kingston for the past few months, I just really want to let everyone know it's been crucial that all the work that the United Way has done and bringing organizations together, bringing key players around the table, and with the awareness campaign, setting the groundwork and setting the just raising awareness around youth homelessness in our community in general. For all of those out there that are frontline service providers, I think you generally know we're working with a vulnerable population and generally understaffed and working very, very hard, obviously. So things like raising awareness and campaigns aren't always top priority for us frontline service providers. So when we have an organization like the United Way to be able to make youth homelessness a priority for them, it's been it's been great for all the frontline service providers here. So typically, the landscape of youth services in Kingston, we have a pretty robust amount of services for young people in our community, but typically it was a very disconnected system. And that is changing, of course, due to all the hard work of the United Way and with all the integration of services that are happening here. But we, with all the organizations having various roles under the different ministries, targeted to do very different work, it was very challenging. And when we first started our 10-year housing and homelessness plan here in Kingston, it soon became very clear that we needed to work better together and to come together with these organizations. So typically, many of the youth serving organizations in Kingston ended at 18, and then young people were expected to navigate a adult system, often working with young people that had very unique challenges and that were still very much youth themselves. And in addition to not only having the challenges of having young people now entering in the adult system itself is very overloaded. So they're working with young people from 16 to 100 years old. So it was pretty clear that we need to think outside the box here. In addition to all the kind of the disconnected services, many young people were having to go to multiple locations to get their needs met. Often many of the young people falling through the cracks. So the idea for our Youth Services Hub was to kind of reach out to the most marginalized young people in our community, to bring key agencies together that support this population better, and to prevent these young people from falling through the cracks. We wanted to create a very youth-friendly environment where youth wanted to be and youth wanted to come. And this process started really a couple of years ago, laying the groundwork for an integrated hub. So this is some very raw data from young people that we asked a couple of years ago before we progressed with our hub. And so our local street health center had a youth drop-in that they ran weekly, and we were able to do some focus group with some young people that accessed that service, as well as some young people that were formerly homeless living in our transitional housing program. So this was kind of the very raw data that youth said. They wanted a location where they felt comfortable, they felt that wasn't clinical, and that was very non-judgmental. They wanted youth services, not that weren't offered that was primarily adult focused. And when we asked what services were most important to them, all these services listed here are pretty much every service that there is available in Kingston. So we don't actually have all these services offered at the hub, but we have many of them for sure. So this would have been, initially we started with about 5 key organizations, and we kind of targeted those organizations based on a lot of the research and data that was coming out through around youth homelessness nationally. And many of that we know, many of the homeless people across the country were kind of, were being discharged into homelessness from Family and Children's Services, from justice, criminal, jail, hospital. And so we really wanted to kind of target those key organizations that could support us with this population of young people. So some of the key players initially were employment services, our street health, and our addiction mental health supports that we targeted initially, and employment services as well. And then we branched out to kind of encompass and targeting all these other organizations. So this diagram you see here was very early on, and we were thinking what would it look like ideally for all these services to work under one roof. Basically, our mission is that One Roof Kingston Youth Hub provides service integration for young people in an open and inclusive single site location in order to ensure quick access to appropriate supports. Our vision is that all young people deserve access to a range of services when they need them, and to have their voices heard in a setting which will listen, engage, and empower them. So we received, it was very challenging because we've been working together as key service providers for a couple of years now, but there was only kind of so much that we could do without funding, because we were all working off the side of our desks. So we didn't have what it would actually look like should funding come through. And then all of a sudden we received a 13-month grant from Employment and Social Development Canada through their innovative solutions to end homelessness. And that funding will take us to the end of September of this year. And then thanks to a community investment grant through the United Way in the City of Kingston, that'll provide us sufficient funding to take us to the end of this year. We then received a $25,000 Home Depot grant through their Orange Door programs, so that we can pay youth to sit on our advisory committee, pay for their transportation, and pay for community youth engagement events. So we, at this point, do not have sustainability past this year, but we are in the process of applying for other grant opportunities. Currently, these are all the service providers that are around the table. So we're up to 20. We started with 5 a couple of years ago, and gradually that grew. And when we opened the doors to the Youth Hub on October, the word got out and service providers started coming to us. They started asking how they can help, and they wanted to be a part of the hub, and they wanted to offer services and supports out of the hub, which was fantastic. So these organizations are pretty much all the organizations for young people in our community, which is fantastic, offering supports in some capacity or the other. Some of staff from these organizations are working directly at the hub, supporting the hub, and other are offering services, and then other organizations are running groups. So this is how our governance structure of the hub. We're run by 3 committees direct all the services and supports that happen at the hub. So we have the leadership committee, the staff committee, and the youth advisory committee. So the leadership committee is managers and directors from all the organizations that are supporting a hub model. The staff committee are all the frontline staff that are working at the hub delivering services or groups. And then the youth advisory committee are youth themselves that are using the hub or wanting to support. So we meet monthly, with each committee, and there's a member, youth or 2 from the youth advisory committee that sits on all 3 committees, so that the voice of youth is heard throughout the governance structure. So this was early on when we had a month and a half to kind of get our space up and running. So it looks, that building in the back, it looks a little bit better than it does there, but we had a youth mental health group assist us with some of the painting and getting the hub ready as we open the doors on October. So currently we are offering housing supports and addictions, counseling supports, anti-oppression and life skills. Weekly groups that are running out of the space is our Fuse group, which is an LGBTQ2S group for youth that are 13 to 19 years of age. We have Indigenous programming that runs once a week, a New Mentality, which is a youth-led mental health group, and a Young Women's Empowerment group. And all these groups are run out of the space by various organizations, such as Girls Inc., the Maltby Center here, and HARS, which is our HIV/AIDS regional services here in Kingston. And then we do offer, our hours are about 9 till 6, 5 days a week. Unfortunately, we're seeing an increased need for young people coming into the hub, and it would be ideal if we could offer some weekend support and extended hour supports for sure. This is just we put out a monthly newsletter to all organizations and distribute it to for youth themselves and for organizations, so that so everyone is aware of what's happening at the hub monthly. So stats to date from October 1st to February 28th. We saw 94 unique youth come into the hub. Referrals made were 61 housing related, 28 for mental health and addiction issues, and 18 were there because we have drop-in counseling services 2 days a week that is offered by Resolve Counseling. And people need to keep in mind too that when we first opened, we had very little promotional work done. So we were seeing numbers in that first month. I think we saw 50 unique youth, and that was without any public relations. No, we didn't even have postcards or a pamphlet to give to service providers or distribute. So this was strictly word of mouth and just from the youth themselves that were accessing the hub. Now we are getting a lot more media attention and we are getting a lot more PR work. So I think that's part of the reason we're seeing the numbers increase, which is fantastic. We also worked with public health to become an official naloxone distribution site. So from March 9th to the 18th, so 9 days, we distributed 60 naloxone kits to give to youth. So I think that's fantastic. Some lessons that we've learned along the way is, so like I said, when we actually received funding, we kind of had to work really quick. We had about a 2-month window to secure a place and kind of define everyone's roles, and we did have memorandums of understandings in place with service providers already, but I think we did what we maybe neglected to do a little bit, and it is engage the frontline staff more. So we were certainly working well with leaders and managers around the table, but I think we needed more communication with the frontline service providers before we opened around where they saw their roles are. So we're doing that as we open, and we're learning as we go. And we're kind of changing things up all the time based on feedback from the people providing the services at One Roof. What we're seeing too is lots of young people coming in needing immediate crisis intervention, and we don't necessarily have the staffing or capacity to deal with all these young people. So we're working on how we're going to address this. Also really think about what ideal hours are like. When you're working with multiple organizations, everyone's working under their own mandates. They might be open 9 till 4:30 or 8 till 4. But when you're working with young people, I think most people know that if you can open outside the typical hours and on weekends, that would serve these young people that we're working with much better. So all being around on the same page around what the hours should look like and who's going to support those hours, and just don't under budget yourself. So some of the future wish lists, what we've seen in the past 4 months of being open, and as youth are accessing our space more and more, is supporting the needs of transitional age youth in the area of mental health and addiction, taking a concurrent approach to supporting these young people that have lots of addiction issues, but also often related to trauma and abuse and underlying mental health issues as well. Providing some form of crisis support to these young people so that we can get them immediate assistance to help support them through that crisis. Developing a collaborative harm reduction approach for high-risk youth. So although all the organizations around the table are mandated to do very different work in the roles of, child protection, addiction and mental health, I think that by working together, we're really taking a common approach to working with these young people and what we can do differently and what we can do when we're working together to address some of these high risk young people and help keep them safe. So I think some of the challenges has been not all the organizations around the table are as familiar with a harm reduction model or maybe the risks of some of these youth. So I think what this model has done is really raise awareness and take that common approach, because it's not a youth with mental health or addiction issues, it's not a homeless issue, it's not a family and children's services issue, that it really is a community issue and that we need to work together to help support these youth and help keep them safe. We also want to work on developing peer support programs. What we're finding is that youth are really wanting to give back to the space. They're taking a lot of ownership and engagement in the space, offering to clean up and do work, and even to supervise some areas in a peer support way. So we'd really like to develop those programs, and also around expanding our hours of operation. And what we're seeing is that a lot of crises are happening on Friday, and a lot of kind of having to address those crises on a Monday, because there's not a lot of supports for young people on the weekend. And then also exploring some social enterprise opportunities and partnerships for some of the young people that we're seeing access the hub. And so these are just pictures. As you can see, it's a very non-clinical space. We have a loft upstairs and a big open space with offices on the main floor. And then we have a basement space where most of the programs run. This is thanks to Novellas Kingston and the United Way helped to, oops, I don't know what happened there, but they helped to renovate the basement space so that it looks great. And that's the young people are really taking ownership and have decorated and painted the entire basement. So it's been fantastic. And I think that's the end of That's it for me. So thanks very much.
Fantastic. Thanks so much. Pavna, Kim, and Tara, that was wonderful. Pretty exciting stuff happening in Kingston, and I'm sure we'll get some great questions for that. I'm just looking at the ones that are posted there now. I just wanted to do a shout out to Auckland, New Zealand. Welcome to you folks from way out there or down there. Pretty impressive that you join us. I guess it's nighttime. Thank you. I also wanted to, I'll just skip through some of these questions. I'll encourage everyone to please put their questions into the question box now. The ones I would like to just say to Tara, I know I asked you to focus on the youth hub, but I am interested in how youth access housing, and I know you do operate a Housing First for Youth program at Home-Based Housing too. Is there anything you can share with us about how that program intersects with the work you do at the hub, or how that flows together a bit?
Yes, so we work closely with the Kingston Youth Shelter. We have prevention diversion staff through Home-Based Housing and the Kingston Youth Shelter that kind of are the first point of contact for young people that are have housing issues or are homeless. And then we've adopted kind of the OR code and using the SPDAT to generate an acuity score for these young people and then get them connected to Housing First services. Within that as well, we also have access to our own transitional and supportive housing programs. So some of the young people are able to access our transitional housing or supportive housing if appropriate, or a rent supplement through the city of Kingston if a community scattered site approach is better for the young person.
Great. And just one other thing too, I know you, and maybe this is a little bit too detailed, but just a comment or any sort of insights into the sort of policy piece around, like you've got 20 partners there, like that's really impressive. And I'm interested in how you kind of keep that all organized and where the accountability is, and you know, sort of, do you have an executive there, and do you have some kind of policies or MOUs or agreements that create a governance model for that hub, or how does that work just in general? You know, that's
so we have MOUs in place with some of the key service providers that are delivering on-site support at the hub, and then any kind of changes or policies or around risks or goes through all the governance structure. So it goes to the leadership team, the staff committee, and the youth committee around to really direct that service. So for example, when we approached public health around becoming a naloxone distribution site, we went through all 3 levels of governance, and the general consensus was that we should be a naloxone kit, because what we were noticing is that a lot of these young people weren't accessing the spaces that they could access these kits because they were mostly for adults, and they weren't feeling comfortable accessing them. So, but because Home-Based Housing has taken the lead, it did have to go to our board of directors for final approval around becoming a naloxone site.
Okay, that's great. So no issues there then. Everything's running smooth as silk.
Well, you can email me privately. No, okay. No, I'm just kidding.
But to be fair, like it's a lot of work to have, you know, multiple agencies and build that common agenda in that hub as well too. So kudos to you, and fantastic work. That's really exciting. I'm sure there's a lot of folks will want to reach out to you, Tara, to get some, you know, maybe some copies of your agreements or policies, that kind of thing, that if they want to start this out. And then I was just thinking as well, Pavna and Kim, I know that you have a number of other policies and strategies in the Kingston area, and I'm just wondering if you could speak a little bit to how the work of the sort of youth homelessness collective impact work aligns up with, for example, the employment strategy work, or I know you've got a pretty strong 10-year homelessness plan. So I'm just wondering if you could maybe provide some comment around that, because it's really important when we work with strategies and plans to integrate and align our work within the community and, you know, across sectors and across policies. So.
Well, I think we were really grateful to the city because they were undergoing their 10-year homelessness plan and they agreed to park the youth homelessness piece, awaiting the results of our community plan. That was really helpful because if they had gone without the kind of data and the strategy that we were developing as a group, we might have gone in a slightly different direction from the initial conversations we had. So that was the first step. Along the way, we've had to do a lot of work as a steering committee on what policies were barriers for our youth. So for example, a simple thing like social assistance for youth at the age of 16 to 18 is a challenge. And we work really closely with the city again on adapting their approach to this so that more youth could, just to remove some of the barriers that they were facing. Another piece was around the definition of homelessness. If you use the adult definition, with the shelter, then anyone who had a place to go that night was not welcome in the shelter. Well, for youth, we believe that just taking the first step and knocking on the door of a shelter or a youth service is really important. So just because they had a couch to sleep in was not necessarily the safest way for them to be. So having the city come on board with adapting their definition for youth and making it different from adults. We all know the reasons youth are homeless are different and the solutions have to be different. So it takes constant monitoring of what's happening in our community to adapt and influence. And again, this is where our steering committee and our youth themselves are great advisors.
That's amazing. Thank you. Yeah, I know you've done some pretty impressive work with that, and just a shout out to your youth employment strategy too. It's pretty comprehensive, and I know that there's been a lot of great outcomes from that as well. So that's fantastic. I'll just kind of float over to our questions. So right away, we've got Scott from the Wellesley Institute has asked for how and which data you collected, and especially your outcomes. He actually had to leave, but I think, and he's provided an email address for you to contact him personally, but I just wanted to give you an opportunity to sort of return to that topic again. If you could add anything or strengthen what you've already said, that would be great, I think, for all of us.
Well, I think this is where Kim can probably provide more insight. But I'll just start with saying that it started with us just collectively, and Tara had a key role in this, using a common database. So HIFIS is what our community uses. We're really intentionally using it for youth and starting from that. But then again, as we developed a theory of change, the steering committee helped us with the indicators. And Kim will talk a little bit about the data.
Hi, yes. So we worked really closely with our agencies, shelter, transitional housing providers, initially around collecting stats on what the lay of the land was really like with regard to youth who were entering and accessing services. So we got input regarding everything from age and gender to reasons why youth were coming to the door of the shelter, for example, or transitional housing. How long they had maybe been precariously housed before, getting to that point, and then also once they were engaged with the programs, looking at the kinds of supports that they were in need of. So referrals back out to community, to things like addiction, mental health, education, what have you, and then how long did it take for them to exit shelter, as an example, to either maybe go back, maybe return back home with family because places had been put in place through mediation efforts, or there had been assistance to find them transitional housing with maybe youth services through home-based housing, or youth shelter themselves have transitional housing, or out into the community in available rental spaces there. And other reasons, maybe they exited because they ended up going into the justice system. So we collected all kinds of data points in that regard to give us an idea of not only the reasons, but how long then youth were staying involved in the shelter, and then where they were going. And so what was the rate of towards our overall goal of ensuring that youth are housed, 80% of youth are housed within 30 days. Of entering, yeah. So we always use that as a guiding point to sort of collect data points around.
Fantastic. Thank you so much. That's really rich information. Martin Naden says, I would love to have any and all information to be able to do this in Cornwall. And he wants a copy of the PowerPoint. So don't worry, there will be a recording of this and a PowerPoint on our website in a few days. But Martin, I know it's great that they're doing all this work. I would suggest to you, Martin, that your community check out our Youth Homelessness Community Planning Toolkit to think about maybe doing a community planning process or a collective impact process in Cornwall. Are there any other comments from any of the presenters for Martin? Because it's such a broad question, I'm sure any and all.
So, Mary Jane, we've got a page on our website, unitedwaykfla.ca/youth, and that has our old reports when we started, so you can see the graduation, how we started, how we even, the raw data from some of our community consultations, the plan that we developed, a really recent update that was just released in January is on our website as well. So I'd encourage Martin to go to our website, and then it's close enough, feel free to set up some time and come and visit us, and we'll go over to the hub and you can see some of the places we're talking about.
That's fantastic. It's really true too. You provide a lot of detail on your website. I really appreciate that too. So thank you. Thank you very much. So Rashida Gwynn asks for any tips and tricks, advice for engaging with private market landlords to partner with in providing housing first for youth, particularly scattered site community housing. And I'm not sure who to go with there. Maybe we could have Kim and Pam approach it from the collective impact, like your role with landlords, and then maybe Tara, you can sort of follow up with the specifics around your program.
I think actually it's Tara who has most experience in this, so I'll let her. Yeah.
Okay.
So our community has, our city has funded a housing liaison worker. So that the role of that person is really to go out and work with the landlords, engaging them, selling the Housing First program, working with the case managers on any landlord issues. So it's a challenging role, certainly because you need to balance the needs of the clients, but also the needs of the landlords in the community, because as we probably know, one kind of client that has destroyed a unit can then leave a bad taste in a private market landlord's. So we need to do a lot of work. So with that, with the City of Kingston, they also have a damage protocol to reassure landlords. So I'm not sure exactly what the answer is without the support of your municipality and the funding to be able to kind of work with the landlords and the program.
Great, thank you. Next one is also on the hub. How do you address and this is from Amy Lee, how do you address the culture, common beliefs, and approach among the various partners? That's a great question. What developmental exercise did you go through, and would you recommend to ensure similar values and culture within the hub? That's actually a great question for Tara, to get that culture and that change management shift in your organization, where you have possibly different 20 different organizations with different perspectives on some of the issues.
It's a great question, because it's I'm not sure it's something I really anticipated until we started opening our doors and working together and realizing the different approaches and the different of all the different organizations, and which I'm not sure why I didn't really think of that. But what we're doing, so our program coordinator that coordinates the hub, she is fantastic in engaging presenters and presenting herself. So her background really comes in addiction and harm reduction and anti-oppression. So we put on bi-monthly workshops for all service users of the hub. So for all service providers that are working out of the hub, from anti-oppression to harm reduction to any of the presenting issues that people have. So we go back to the leadership and the frontline staff, and we ask what their what their most important areas are that they would like training in. And so then we try to, then we offer those trainings at the hub. And then in addition, we have had lots of conversations around the Youth Homelessness Steering Committee that the United Way leads around a common approach to working with these young people, and working from a really trauma-informed lens has come up, and providing some of that training across the sectors is really important. So most recently, we've chatted a lot about trauma and dialect behavioral therapy, and a common training and a common approach to working with all these young people. And it's having engaged our community health science centers on board as well. They're really engaged in delivering some of those programs as well.
Fantastic, thank you.
Can I just add too, from sort of an onset structural perspective, I know when being a part of the table that came together in the initial formation of, you know, how to bring a hub to fruition, I think that first of all, the desire of the agencies in the community to all come together with their focus specifically on what can be done to help youth in particular. So that was steadfast throughout the whole process. And then also, I think that realizing the difference, and we had some great instruction on this, the difference between collective impact approach versus collaboration. And I think once the group sort of realized that the hub is definitely a collaboration among many organizations coming together, that's been a really strong foundation. And then, as Tara has said, now that it's sort of on the ground and running, everybody is realizing perhaps what their differences are, but that strong focus on, we're in this together, we're collaborating, what do we need to do for the benefit of our youth in the community, has really been strong and powerful to keep it going.
That's fantastic, and I do really, I am really grateful for your distinction there between collective impact and collaboration. I think that's really important to keep in mind moving forward, and it's something I've been giving a lot of thought about too. But that's fantastic. Thank you so much, both of you. So Becky Alala asks, how did you fund the transportation for youth, and how did you distinguish between homeless youth and those youth not involved in your programming? So I think that's.
So Kingston Council actually passed a motion last year, and they continue to do that for any youth who's in high school. They get free bus passes, so we didn't have to do very much for that.
Yeah, and in regards to the hub, I think I had one slide that we are providing transportation for our youth advisory committee, and that's coming from the Home Depot grant that we did receive through their Orange Door project.
Okay. And then they said, how did you distinguish between homeless youth and those youth not involved in your programming? I'm not sure what that.
Yeah, I'm not sure. So any young person anyone can access the hub, any youth, yeah. Whether they're homeless or not.
Okay, and all youth can access the bus as well. So probably not there is no distinction. Martin again, Martin asks, where is the best place to go to attain funding for all similar projects and services that you offer? That's a great one. That's the ultimate question.
There's lots of funding from Innoweave, Laidlaw Foundation, Home Depot. There's some very targeted youth funding pieces. Trillium Foundation, if you're starting off on collective impact, you should probably start looking at that. Most United Ways will fund programs, so you can look into that if you have your strategy developed. I know we were really grateful with Innoweave, because if they hadn't given us the backbone coordination, we wouldn't have gone as far as we did.
Exactly. Yes, this is very true. Tara, do you have anything to add in terms of sort of some of the funding, or?
I think Pavna covered it. We did, I mean, we got the 1-year funding from Employment and Social Development Canada. Of course, we are looking for sustainability. I think we did apply for a Trillium grant, and the OTF, if you're in Ontario, offers a variety of different grants out there. So I think that's a good place to explore as well.
And if you have HPS in your community, that's another source, because we are funding a portion from there.
Oh yeah.
HPS and I know that there is a trend now because like towards collective impact, but towards any kind of social innovation funding. I believe the Ontario government is doing some of this as well. So this is kind of a growing type of funding that funds both more collective impact, but also any kind of innovative strategies or programs that are working from like innovative perspectives. So there's a lot more of that coming out now. And any of the large philanthropists, you can kind of check them out depending on the year, the Catherine Donnelly Foundation, the Maytree. There are many different foundations, the private family foundations that offer some of this funding that will support that infrastructure to get some of this going, and maybe a little bit off the map. And so maybe not so much program funding, but some more of this other type of funding that can give you more backbone support, more evaluation support, some of the things that are harder to get funded. And of course, your United Way. Well, we got.
Well, and in our report, we've actually at the back listed our sources of funding. And Mary Jane, you're absolutely right. One of our largest gifts, we got $1.2 million from one donor who supported the transitional house for young 16 to 19. Yeah,
that was fantastic too. So, but having a strong United Way with that's involved in youth homelessness is pretty substantial, because that does pull in and create the awareness that private funders to support the issue. So that's fantastic. I think we're out of questions at the bottom. I think I've covered anything. Are there any closing thoughts that you don't have to, but if you have any closing thoughts or anything that's kind of cropped up in these questions, if you wanted to add in, that would be great. No, we're all tired. Okay.
Yeah, no, I just think we appreciate the opportunity, and in a short time we can't pack everything that happened, but it's an amazing community that's come together. I think if I have any advice to give any of you, it's to start collecting stories, because that's what gets you funding, that's what gets you the buy-in. Having the voice of youth behind us when we went to City Council, that's what got us in the door. Having those stories everywhere we went, having youth with us. One of our youth told me I was too old. She should be the one talking about youth homelessness. So she actually met with the mayor and convinced him. But really leverage the youth in your community. They're your best resource.
This is true. Thank you. And Kingston's been a real star in this regard. And just to kind of close off doing a community plan or taking on a community planning process with a collective impact framework is a lot of work. As I've pointed out, we have a number of resources at Away Home. It is, but it's definitely worthwhile, because the issue is so complex. It's considered a wicked problem, as many of you may have heard or understood. And this is a process that takes a little bit more time up front, but it's well worth it. And I think Kingston is a really great example of how that investment is paying off. If we really are going to shift move the dial and shift the situation for young people experiencing homelessness and really end it, then it's this upfront work that takes part. And we're at Away Home, we're very committed to supporting communities everywhere to do this work. So I encourage you all to take a look at the community planning toolkit. Talk to some folks in your community. If you're considering it, give us a call or an email and maybe explore whether or not you want to do that. If you're already engaged in this process, please reach out to us if you haven't already. We are supporting a number of communities across Ontario with this work. So I think on that note, I think I'll close this down, and I really appreciate all of you folks who attended. Special thanks to Tara, to Kim, and to Pavna from Kingston for all the amazing work they do and giving us this opportunity to hear a bit more about some of that and all the work that they've accomplished. And thank you as well to the young people in Kingston who put so much effort and heart into building, working alongside you folks in building all of this work is really due to them, as you pointed out. So thanks so much, and thanks, Naveen. That's me over.
Thank you.
Okay. Take care.